Have you ever experienced strange health symptoms that no doctor seems to have an answer for? Things like UTI symptoms with no infection, chest pressure out of nowhere, or unexplained hives? If this sounds familiar and you have endometriosis or suspect you might have endometriosis, this video is for you. Today we're talking about 5 bizarre symptoms that could actually be endometriosis in disguise, plus what you can do to help. Before we jump in, please give this video a like, share it with a friend, and hit that subscribe button if you haven't already. So symptom number 1 is UTI-like symptoms with no bacteria present in laboratory testing. One of the most surprising symptoms, feeling like you have a urinary tract infection, but every test comes back negative. Frequent urination, urgency, burning, but no bacteria in sight. This could be due to bladder endometriosis, endo on the ureters, which are the tubes that carry urine from the kidneys to the bladder, or referred inflammation irritating the bladder wall. It can also mimic or overlap with interstitial cystitis, which is more common in people with endometriosis. It's a common co-condition. So 2 tips to support this if this is a symptom that you're experiencing. One is to try D-mannose and or a vaginal probiotic. D-mannose is a naturally occurring simple sugar that is helpful in the prevention of UTIs or in calming UTI-like symptoms. It can be very helpful for painful bladder syndrome or symptoms like urgency, frequency, or pressure. 500 to 2,000 milligrams daily can be very helpful. Lactobacillus crispus probiotic strains have been shown to help with preventing UTIs and reducing symptoms of UTIs. My favorite brands are Good Clean Love and Vagibiome. Next tip is to be mindful of bladder triggers like caffeine, alcohol, spicy foods, citrus, artificial sweeteners, and or carbonated drinks. Some other helpful tools to consider include quercetin, magnesium, electrolytes, NAC, aloe vera extract, and pelvic floor physiotherapy. If you have questions about these supports or would like me to create a video with more details on these supports in future videos, let me know in the comments below. Okay, symptom number 2 is chest pain or pressure at the base of the neck or difficulty breathing. These symptoms can be a sign of thoracic endometriosis, where endometriosis tissue grows in or near the lungs or diaphragm. It's not as common as endo located in the cul-de-sac, on the ovaries, on the bladder or bowels, but it is very much real. Some people with thoracic endo only get these symptoms around ovulation or the period, but symptoms can also persist all cycle and change with hormonal fluctuations. So a few tips to support this. First, track your symptoms across your cycle. If breathing issues flare cyclically, bring that to your gynecologist or thoracic specialist. Support diaphragmatic movement with deep belly breathing or myofascial therapy. It may help reduce fascial restrictions caused by inflammation. I also did an interview with Dr. Francesco, who's a thoracic surgeon. He provides great tips on how to get the best care if you suspect thoracic endometriosis, so I will link to that video in the show notes below. Anecdotally, I have also found bioidentical progesterone to be immensely helpful with clients who have thoracic endometriosis. I don't have research to present on this link, but in case it helps you reclaim some quality of life, I did want to share this. I'll link to my favorite over-the-counter option in the show notes below. Just make sure you understand how to apply it correctly as to not disrupt your cycle. Symptom number 3 is skin rashes, hives, or allergy-like reactions. Skin reactions like hives, eczema, or sudden allergies are very common in people with endometriosis. Why? Well, one possible reason, although there are many, is that people with endo often have immune dysregulation and excessive mast cell activation, which in turn can lead to increased histamine and inflammatory skin responses. If you are somebody who is trying to conceive, it's extra important that you keep your eyes peeled for these symptoms, as it can indicate an immune storm brewing beneath the surface that can lead to difficulties becoming or maintaining a pregnancy. I'll link to my video on getting pregnant with endo, where I talk about some immune dysfunction labs and supports to seek out if you relate to this or want to learn more on the topic. All right, a few tips to support this. So first, understand whether the gut or estrogen might be triggers for the histamine excess symptoms. You can test estrogen in the blood or through a functional test like a Dutch test. You shouldn't be seeing estradiol over 300 pg per mil or over 1101 pmol per liter in the luteal phase. Roughly, this should be checked about 7 days post-ovulation. Things like a history with antibiotics, anal itching, worsening symptoms with constipation, having constipation or worsening symptoms with histamine probiotic strains can give you some insight into whether the gut may be a source. Just to clarify that last one, if you take a probiotic and you get really itchy or you get congested or you get mucus buildup, that could be an indication that you're taking a probiotic strain that can make histamine, and that could be an indication that you have an underlying histamine issue. Supplements like vitamin C and DAO enzyme can help your body process histamine more efficiently, so those are great supplements to look for as well. Symptom number 4 is brain fog and word finding difficulty. You're in the middle of a sentence and suddenly you can't find the word. Sound familiar? Cognitive symptoms like brain fog, forgetfulness, and trouble concentrating are often linked to inflammation or hormonal imbalances. Stress caused by chronic inflammation is a root cause for brain inflammation. So a couple of tips to support this. The main effective tips here include anything and everything that can help reduce inflammation. This might include structuring and spacing your meals for blood sugar balance, omega-3s, fruit and vegetable juices, exercise, good sleep, Curamed or turmeric supplement, vitamin C and E, eating a Mediterranean style diet, or magnesium. But another thing to consider for brain inflammation specifically is targeted supplements that can cross the blood-brain barrier and reduce brain inflammation specifically. This might include 100 to 200 milligrams of L-theanine, 1.5 to 3 grams of omega-3s, or liposomal NAC, vitamin C, phosphatidylserine, resveratrol, alpha-lipoic acid, or CoQ10. Symptom number 5 is leg pain, sciatica, or tingling sensations. If you're experiencing numbness, tingling, or pain in the legs that worsens around your period, many of us get pain or weakness in the legs with endo, so don't let your mind go to dark places with this one. Sciatic endo is a rare but definitely serious form of endo where lesions press on or irritate the sciatic nerve, causing radiating pain. It may be somewhat rare, but it is definitely important to address it if it is suspected, as advanced cases can cause nerve damage or even loss of leg function. If you experience painful cyclical pain that flares during or just before your period that causes numbness or tingling in your buttocks, hamstring, calf, or foot that generates muscle weakness causing difficulty with walking or climbing stairs, or if you experience pain with sitting or sitting cross-legged, definitely have yourself assessed. So a couple tips to support this: pelvic floor therapy can help if muscle tension is compounding on top of nerve irritation. Anti-inflammatory herbs like turmeric or Curamed, boswellia, PEA, or acetyl L-carnitine are helpful supports, not just for overall inflammatory support, but also nerve inflammation specifically. Okay, so let's recap. If you're experiencing UTI-like symptoms with no infection, chest pain, pressure, or breathing issues, skin rashes or allergy-like symptoms, brain fog, or leg pain or tingling, it is absolutely not all in your head. It could be endometriosis showing up in unexpected ways. You deserve answers, and more importantly, you deserve support. If you found this video helpful, hit that like button, share this with a friend who needs to hear it, and comment below with the most bizarre symptom you've experienced with endometriosis. Thanks for watching today's video, and I'll see you in the next one.